it's frustrating that you have insurance because you have to have the insurance. And you still struggle to pay medical bills if somebody gets sick. Insurance is supposed to cover that, right? Because insurance is basically in case shit happens. And when shit happens, you shouldn't have to worry. But yet, that's not how it works. Such a grand system we have here.
Of this group, 63% had to pay most or all of their savings to cover the medical bills.
So we've taken a look or two or three at the American healthcare system on the channel in the past. This go around, we'll be looking at why American healthcare is worse in the developed world. So just throwing this out there, probably the, the for-profit nature of everything, probably a deciding factor if I had to venture a guess. But that being said, let's get into it.
I wonder if you could tell me how expensive you think calling an ambulance out to your location is in America.
Okay, is there a price for that?
Yes.
Jeez, $100? $100?
$2.5 grand.
For what? Why?
They billed our insurance company over $3 million for the cost of transplant. I don't know what people do without insurance. How could you even begin to pay that?
She said the bill is up to $80,000 already, and she said, Mrs. Weinkauf, I hope you realize that you're responsible for this bill. I thought, what am I going to do? I've worked my whole life. Is this how my life is going to end?
In a previous episode, I briefly touched on the failures of the American healthcare system. That
$474,000. Or the person before that needed the transplant, apparently $3 million. Father-in-law got cancer, worked for 30, right at 30 years. Wind up having to use up his 401k to pay what the insurance didn't cover for cancer treatments and stuff of that nature. In the video right here, that's examples of why the American healthcare system is the worst in the developed world. Hell, I think worse than any kind of the world. I don't care if it's a developed nation or not. Probably get better treatment, or probably cost you a lot less to die, even in underdeveloped countries.
That section of the video prompted all sorts of responses in the comments, mostly from Europeans who were horrified to learn that Americans have to pay for an ambulance ride to the hospital, but also a handful of brave patriots who claim, without evidence, that the American healthcare system is the best in the world. This video is for those people. Let's jump right in. I'm gonna throw a bunch of statistics at you, and then we'll look at the root cause of the problem. America spends more money per capita on healthcare than any other nation on Earth. You would think that this expenditure would guarantee the best care in the world. That is not the case. In fact, despite being the most expensive healthcare system on Earth, consuming over 16% of our GDP, it's one of, if not the least effective in the developed world.
Not only, this is one of the things that burns me up just as well as the fact that you can be in a big city and you got 2 or 3 different emergency rooms that you can go to, and your level of care at each of them is different. And a lot of you go to a hospital that's in a middle class neighborhood, you get some pretty good care. You go to one that's in low income poverty area, and your level of care is going to be awful. There's people that show up there with insurance. There's people. A lot of these places are state funded. Why is it worse just based on income? Who cares if they only got Medicaid, Medicare? Why? And I don't understand the concept behind that. Is that to me is what's crazy. Spend so much, 12% of the GDP on healthcare. Everybody's sick or dying and costing a fortune to do so.
We spend over $10,000 per capita on healthcare, and not only is the quality of care subpar, we don't even cover everybody. Compare this to places like Germany, who pay drastically less per capita and guarantee coverage to all their citizens. There were over 27 million uninsured Americans in 2018, and that number will have skyrocketed in recent months, thanks to the millions of layoffs across the country. Even before the epidemic, we had more uninsured and underinsured citizens than any other developed nation. In addition to not covering a large portion of the population, even those with excellent, by American standards, health insurance struggle to pay medical bills. Over 25% of insured people reported having difficulty paying for the exorbitant cost of their treatment.
Because here's the reason why for that. Your well-insured American is paying $125, $150 a week for healthcare premiums. Though on top of that, your deductible. which can be $1,500 to $9,000 per person under that plan. Not total, per freaking person. So if you've got a family of 4, that's $6,000 a deductible that has to be paid before insurance covers 100%. Then on top of that, you can't tell this is a touchy subject for me because so many of my fellow countrymen are absolute morons. Because they're like, oh yeah, we got the best healthcare system in the world. And it's like, no, we don't. Why does everybody come here? Everybody doesn't come here. The only people that come here are people that can only get the specialized care at a certain hospital here. Wow, who fucking figured? But this type of shit's one of the things that just burns me up about this country. It's socialism. Shut up, you're an idiot. You don't know what socialism is. You point at Sweden or you point at Germany and France, and they're not socialist. Having a big social plan does not make you socialist. That's an economic model. Jesus Christ, Lord. What are we teaching our fucking kids? Better yet, why do we have, oh, Jesus, I could go so in depth with this. If I wanted to, it's just, I don't want a 6-hour video. Yes, it's frustrating that you have insurance because you have to have the insurance. And you still struggle to pay medical bills if somebody gets sick. Insurance is supposed to cover that, right? Because insurance is basically in case shit happens. And when shit happens, you shouldn't have to worry. But yet, that's not how it works. Such a grand fucking system we have here.
Of this group, 63% had to pay most or all of their savings to cover the medical bills, and 42% had to get a second job. Life-saving drugs in America often cost 10 times what they cost in other countries. For example, in Canada, 1 vial of insulin costs $32. In the United States, the same drug from the same factory costs $300. And that's not even an extreme example. Take the HIV drug Truvada. In Australia, it costs just $8. In the United States, it costs $2,000, despite US taxpayers footing the bill for its development. Every year, over
Jesus
500,000 people
dude,
go
what
bankrupt
the hell?
trying to pay their medical bills. In a country where 40% of the population can't afford a surprise $400 expense, an ambulance ride to the hospital will cost you more than twice that amount. And all of this is happening in the richest country on earth. If we have the resources and we're
Richest country. I think that's the biggest misnomer. Our government is rich. We the fucking people are not. And I wish more of we the fucking people would wake up and see that shit. I'm a little bit pissed. Can you tell?
We're so much better than all the other countries. Why is our healthcare system so broken? Here's the thing. It's not broken. It's functioning exactly as you'd expect.
As intended.
America's
Yes,
healthcare
exactly.
system is for profit. That means instead of providing care because it's the ethical thing to do, they only do it because there's a big check involved.
Because it costs more money to keep people sick and coming back into the system than curing the fucking shit that they've got.
Back in the 30s, Blue Cross and Blue Shield were the 2 main health insurance providers in the US. In those days, they operated as nonprofits and wouldn't turn anyone away for any reason. Then, after World War II, employers started offering health insurance as a benefit, and between 1940 and 1955, the percentage of insured Americans jumped from 10% to over 60%. This new demand for health insurance caught the eye of many business people, and the for-profit healthcare industry was born. By 1951, big names like Aetna and Cigna were major players in the industry, which continued to grow through the 70s and 80s. In the 80s, the country began to see its first for-profit hospitals, operated by large investors who owned multi-hospital chains. By 1981, 1 in 7 hospitals in the US was for-profit. Suddenly, medical bills became a lot longer and more convoluted. Every little thing became an itemized expense, from tissues to plastic cups to being able to hold your baby after it's born. The hospital's transition from philanthropy to corporation was complete. This is not normal in other countries. America had taken the intensely cruel step of taking something sacred, the health and well-being of its citizens, and slapping a price tag on it.
Yeah, doctors here, after they graduate college, they shouldn't be taking the Hippocratic Oath at all. No. They should be asked the question to answer, how can you raise our bottom line? Because that's all it is. That's all that stuff does.
Taking something sacred, the health and well-being of its citizens, and slapping a price tag on it. With this commodification of health came unsurprising side effects. Average American life expectancy is lower than other wealthy countries and has actually begun to decrease in recent years compared to other countries slowly increasing. The US has the highest infant and maternal mortality rates of any developed country. The US has higher rates of medical errors.
The fact that we've got the highest rates of infant and mortality rates should be the flashing beacon, other than the price of this shit, that something is not right here. That right there. We're so developed and we're so rich. We got the highest infant mortality rate. Something's wrong. Can't tell anybody else that, though. Such a great system.
Than other countries. Adults in most other comparable countries have quicker access to a doctor or nurse when they need care, contrary to what American healthcare advocates would have you believe. To make a long story short, in just about every study on the effectiveness of healthcare systems in developed nations, America scores very poorly, most of the time at the very bottom of the list. And other nations are taking notice. Towards the beginning of the coronavirus epidemic, one university in Norway urged its students to come home if they were studying in countries with poorly developed health
US,
systems,
that's crazy.
such as the US.
Yep.
Part of the problem is the American obsession with streamlining or optimization. Anything that doesn't immediately increase profits has to go. Take, for example, the practice of so-called just-in-time delivery of essential equipment such as ventilators. Instead of having an emergency stockpile, including personal protective equipment such as masks and gloves, these items are instead delivered only when the need arises. The idea is to reduce overhead, but in reality it leaves us totally unprepared and under-equipped for a national pandemic. That's why we see pictures of doctors and nurses wearing trash bags, because their hospitals haven't provided adequate protective equipment, and just to be safe, they're firing people who post those kinds of pictures. To their credit, the CDC was planning to address the national shortage of ventilators, but the company to whom they had given the contract was bought out by a larger company, who canceled the project because it wasn't going to be profitable enough. And of course that larger company's name is Covidian, because the architects clearly put an intern in charge of our simulation. I could spend all day listing off instances of absurdly high medical bills, but at the end of the day, some people in America will still defend the practice of for-profit healthcare.
Love that. $70,000 for a broken hip. I owed $80,000 for my broken hip that had to be fixed. They put together, looks like with chicken wire and sheet metal screws, but besides the point, $80,000 bill. Yeah, not wrong. $11,000 air ambulance bill, so they were medevaced. Jesus Christ. If you're an American and you decide to you run across this and you decide to watch, before you comment anything, please, for the love of God, take a deep, deep look at other countries' medical systems outside of ours, because I'm an American. I'm an American. And I don't know how you can comment about us having the greatest system in the world. You must not have had a loved one die from cancer or something medically related that they were supposed to have insurance for, or they had insurance for, but yet still had to drain their personal savings. And you can say planning and all that good stuff, all that ignorant ass bullshit that mostly Republicans take and throw out. You can say that all you want, but the fact of the matter is, 30 years of work, and he's not the only person that I know that's family that's had stuff like this happen. 30 years of work drained his 401k, cancer treatments, full insurance, and really good insurance. You go fuck yourself if you're going to come in my comments, if you're an American, and say anything about how ours is better than the rest of the world, because it means you would rather parrot what a talking head or a politician has said to you than make your own fucking decision on how shit works here and actually learn something. That's what that tells me. If you use a singular thing, as far as like if there's a specialized thing that someone has outside of a normal cancer, a specialized condition, and you use that as a reason, again, just because there's not care for that specific thing in another country, that doesn't negate the entirety of their health care. And for those that want to talk about wait times and things like that, it's been 3 years. 3 fucking years since my kids have seen their personal doctor. And the reason for that is because anytime they're sick or I have to take them for anything, it's easier to go to either a critical care place or to the ER to get seen. So if they need to be held out of school or something of that nature, they've got an actual doctor's note. Because the wait time, doesn't matter insurance or not, the wait time is 6 months. That's just with my kids' doctors. For me, it's a good 2 months. So go f*** yourself with the false equivalencies that you want to take and bring forth. That's coming from an American.
Maybe the best way to get through to these people isn't to show them the bills, but to show them what people in other, saner countries think of the bills. So here you go.
Ambulance call out, how much do you think that costs?
Zero payment.
Zero payment?
Yeah, zero payment.
No, because $2,500.
For real?
An inhaler.
$100.
Yeah, you're pretty close, it's a bit more.
120
$250 to $350.
for an inhaler.
So 2 EpiPens, how much do you reckon they are?
$80.
$600.
$600. What?
EpiPen, something that's needed by someone with a severe allergy. EpiPen, $600. I remember the reason why I stopped watching videos like this. It's coming back to me now. Blood pressure rising, red in the face. Yeah. Cussing more than normal for a video that's this short. Yeah, I see the reason why now.
Why? 100? 200?
Dollars.
Yeah.
The average is about 10 grand. It can go up to 30,000.
10 grand! For a baby!
It's okay to laugh, it's a funny video. But these are the types of reaction you get when you explain to anyone in a first world country besides the US just how screwed up our healthcare system is. We're not paying these exorbitant fees for quality care. We're paying for executive bonuses, shareholder value, and lucrative contracts. Pharmaceutical and medical device companies can charge whatever they want, and the US government will never step in. We're one of the only nations on Earth that doesn't regulate the cost of drugs and medical supplies, and companies negotiate directly with hospitals and insurers to get the best terms. Not best for the patient, best
for the company, yes.
Drug costs in America are many times higher than in any other country. Why? Because that's how it works in a for-profit system. The dollar holds infinitely more value to these corporations than human well-being. The needs of the people are secondary to the profit motive. The American healthcare system is a system that relies on people getting sick and coming in for treatment, which is why we don't see any investment in public health initiatives. A program like Medicare for All would likely solve this and every other health problem produced by the coronavirus pandemic. Everyone would have been able to see a doctor and get tested, which would have given us more accurate data about the illness and its spread. Hospitals wouldn't have to waste energy dealing with private insurers and fighting them on every little thing. And with the profit motive removed from the healthcare equation, the government would have an incentive to prioritize public health to prevent people from getting sick instead of counting on it. That in turn would make us better prepared for the next pandemic. But remember, the system that we have isn't broken. It's functioning exactly as it's meant to. Why do we pay so much money for the worst care in the developed world? And more importantly, why do we put up with it?
Woosah, because the subject of healthcare in this country it's a pet peeve of mine. We get the short end of the stick. I watch my father-in-law. Awesome guy. Right, he took it. There's no reason why you should have to drain your 401k. With insurance and coupled with insurance still. Have to drain your 401k to afford your cancer treatments. That's not a great country. That's a country that's got shit ass backwards. What has happened? I remember now the reason why I don't look at videos like this anymore after the first two that I did. Depresses me, pisses me off, hurts my feelings. I hear that so often from people in this country. Oh yeah, we got the best healthcare system in the world. In what fucking way? In what way? How? How can you say that with a straight face? How much we have to pay for everything? Are you serious? They want to take and bring up wait times and stuff like that. I'm like, bruh, it's a 2 month wait for me to take and go see the doctor. A month or two, excuse me, depending on, unless I get a referral from an emergency room, it's like a 2 month wait. For a specialist? Jesus. You're scheduled out every 3 months. Every 3, 4, 5, 6 months. I've still got to call to get my gastro stuff, or not not the gastro, but the heart stuff looked at, or at least recommendations from the doctor. Do the heart stuff. Everything come back clean on that, but they wanted to take and do a stress test, and it got denied. I'm 40 fucking years old. There's no reason why I should have to take and worry about shit like that. But yeah, no, this is out the ordinary. But no, we're gonna take and deny it. Get fucked. Get fucked. We have the worst healthcare system in the world, hands down. I remember the reason why I don't take a look at this shit no more. At least not for healthcare stuff, because I already know how shitty we got it. Hope y'all enjoyed this. Y'all be good to each other. Love yourselves. Peace.